Hello, I'm Dr. Tiliadis, and I'd like to switch gears now and talk about each of the operations we perform. We will introduce each procedure with a short video and then discuss them in more detail one at a time. But first, we want to describe the general mechanism by which surgeries allow patients to lose weight. There are strictly malabsorptive procedures which limit how many calories can be absorbed. This is done by shortening the intestinal tract so drastically that the food passes through before being completely digested. Second are purely restrictive operations that limit the number of calories that can be consumed by effectively shrinking the stomach, of which the gastric sleeve and lap band are examples. Lastly, the surgery can be a combination of both restriction and malabsorption. The gastric bypass works as so, although not nearly as much shortening of the intestines occurs as in a purely malabsorptive procedure. These operations are performed laparoscopically 99% of the time. That is, with a few small incisions instead of one large incision. This minimally invasive technique is much less painful and allows for a quicker recovery and fewer wound complications such as infections and hernias. Even if you've had a prior abdominal operation, we can almost always avoid the single large incision that was used in the past. Let's now watch a short animated video demonstrating the gastric bypass.
Your surgeon will perform bariatric surgery if your weight loss efforts through lifestyle changes and medications have been unsuccessful. There are two types of bariatric surgery. Restrictive procedures decrease the size of the stomach, so a person feels full quickly. After surgery, the stomach holds about 1 cup of food. A normal stomach holds 4 to 6 cups. Malabsorptive procedures decrease the absorption of calories in the small intestine. Before your procedure, an intravenous line will be started. Bariatric surgery requires general anesthesia, which puts you to sleep for the duration of the procedure. A breathing tube will be inserted through your mouth and into your windpipe to help you breathe during the operation. Gastric bypass, technically referred to as Roux-en-Y gastric bypass, is both a restrictive and malabsorptive procedure because it reduces the size of the stomach and decreases the absorption of calories in the small intestine. Your surgeon will use one of two methods for gastric bypass surgery. The open method requires an 8 to 10-inch incision in the abdomen. The laparoscopic method only requires several small keyhole incisions, through which your surgeon will pass a laparoscope and surgical tools. A laparoscope is a thin, lighted instrument that projects images of the surgery on a monitor in the operating room. During a Roux-en-Y gastric bypass procedure, your surgeon will use surgical staples to create a small compartment, which will serve as your new stomach. This pouch will hold about 1 cup of food. The lower portion of the stomach continues to secrete digestive juices, but does not receive food. Next, your surgeon will cut the small intestine well beyond the stomach and bring one free end up and attach it to the pouch. He or she will then attach the other free end lower down on the small intestine, creating a Y shape. By bypassing the lower stomach and the first part of the small intestine, fewer calories will be absorbed as food passes through this new pathway.
The gastric bypass creates a 1.5 to 2 ounce pouch, thus limiting the amount of food one can consume. As you can see in the picture, the entire stomach and first portion of the small bowel are bypassed, demonstrated by the green arrow. Food traverses the small bowel where the red arrow is in the diagram, but is not digested and absorbed until it reaches the black arrow, because this is where the enzymes from the liver and pancreas join the food and begin digestion. The operation results in a profoundly decreased appetite and being able to feel satisfied or full with a small volume of food. Because the patient is not hungry and can be satisfied with a small amount of food, it is possible to diet effectively long term. The operation takes about 1 to 1.5 hours to perform, and most patients can be discharged the day after surgery. Most weight loss occurs in the first 6 months after surgery, but people will continue to lose weight for about 1 year. The average weight loss is about 60 to 65% of one's excess body weight, or about 60 to 65 pounds for every 100 pounds over one's ideal weight. The operation is safe and effective, but as with any surgery, there can be some risks such as bleeding, infection, or damage to other organs, and for comparison's sake is about 3 to 5 times safer than a total joint replacement. Another risk in the immediate post-op period is the risk of a leak from the pouch, about a 3% chance. This is the main reason the patient is watched overnight, since a leak almost always occurs or manifests itself within the first 24 hours. This complication usually requires laparoscopic surgery to repair the leak. Long-term risks are an ulcer or stricture at the connection between the small bowel and the pouch. These are treatable with medication or endoscopy and usually do not require further surgery. Now let's watch an animation of the lap band procedure.
Banding techniques are restrictive procedures. They help decrease food intake in two ways: by shrinking the stomach to a small pouch and by making a tiny opening from the pouch to the rest of the stomach. Food moves slowly through this opening. These factors make you feel full quicker and for a longer time. An adjustable gastric banding procedure, also known as AGB or lap band. Your surgeon will wrap an inflatable ring around the upper part of the stomach. As the band is inflated, it will squeeze the stomach to create a small upper pouch and a narrow opening into the larger lower portion. This may be done through tiny incisions using a laparoscope. The band may be adjusted at any time. For all methods of bariatric surgery, your surgeon will close your incisions with staples or stitches. After your procedure, your breathing tube will be removed and you will be taken to the recovery area for monitoring. You will be given pain medication and your diet will be gradually advanced over several days.
The lap band is a more straightforward operation and can be performed in approximately 45 minutes. It acts by creating a pouch or false stomach above the band. The concept is that when the pouch above the band is full, the stretch in the stomach sends a signal to the brain that the person is full. Since the pouch is small, the patient can experience fullness and satisfaction with a much smaller volume of food. Therefore, if the patient makes good food choices, he or she can lose weight effectively. The band also has risks associated with it, as do all surgeries. The risk of major complications at the time of surgery is small because of the simplicity of the surgery. But the band is a foreign body which poses its own set of risks. First, it can become infected or it can erode into the stomach, either of which would necessitate removal of the device. This occurs in 1 out of 100 patients. There is a 3% risk of a slip band. This occurs when some stomach slips up under the band and it becomes too tight, resulting in a partial blockage. This can be easily diagnosed, but usually requires laparoscopic surgery to repair. In a small percentage of patients, the band tubing can leak due to fracturing or inadvertent needle sticks during an adjustment. This can be repaired by removing the old port and replacing the connecting portion of tubing. The weight loss is usually slower than with the other operations, and the overall weight loss is the least of the 3 operations. Also, there are more patients that have difficulty losing weight with the band than with the gastric bypass or sleeve gastrectomy. Now we will watch the final animation and then discuss the sleeve gastrectomy as a weight loss operation.
Small incisions are created on the abdomen. Trocars, which serve as passageways for the surgical instruments, are placed into the incisions. Surgical instruments are passed through the trocars to access the abdominal cavity. The surgeon examines the abdomen using a laparoscope or video camera. The average human stomach can expand to hold around 1 to 1.5 liters of food. While in the stomach, food is combined with digestive enzymes to help break down the food into a more simple form so that it can be more easily digested and absorbed once in the small bowel. During a sleeve gastrectomy, a thin vertical sleeve is created by using a stapling device. This sleeve will typically hold between 50 to 150 milliliters, or is about the size of a banana. The excised portion of the stomach is removed. The newly created gastric sleeve is able to hold approximately 1/10 of what the stomach was able to hold before. This smaller stomach sleeve restricts the amount of food you can eat before feeling full. The bile and pancreatic fluids from the liver and pancreas mix with the food and allow it to be completely digested and absorbed in the bowel. There is no rerouting of the small bowel or post-operative adjustments necessary for the sleeve gastrectomy. As with all weight loss procedures, behavior modification and dietary compliance plays a critical part in determining the long-term success of the procedure.
The sleeve gastrectomy is the newest operation available and is rapidly becoming one of the most common operations performed. The operation was originally devised to be a staged procedure in patients who were felt to be too large to safely undergo a gastric bypass. The sleeve would be converted to a gastric bypass at 6 months to allow for optimal weight loss. Several patients on that path refused the second operation and, as it turned out, did not need one. The sleeve patients tend to have very similar weight loss to the gastric bypass patients. The operation involves removing 2/3 of the stomach and creating a long, narrow tube or sleeve-like stomach. This allows the patient to become full with less food and also depresses the appetite effectively. The operation takes about 45 minutes to an hour to perform, and patients go home after an overnight stay in the hospital. It provides greater and faster weight loss than the lap band, but it's not as powerful a tool as the gastric bypass. The advantages over the gastric bypass is that a simpler operation is performed and no rerouting of the small bowel and less nutritional supplements are required post-operatively. It is, however, the only operation we perform that cannot be reversed, and it may cause or exacerbate reflux or indigestion. The operation is well tolerated, and we are seeing very good results thus far. This slide shows what you can expect with weight loss after each of the operations, with the sleeve essentially mirroring the gastric bypass. The weight loss is faster and greater with the bypass and sleeve than with the lap band. Patients should view all these operations as tools to enable them to diet effectively. They work by suppressing the appetite and enabling patients to feel full with a small amount of food. Then, if the patient is taught to choose good foods that are relatively low in calories and high in protein, weight loss can be successful. Appetite, however, can be affected by strong psychological, emotional, and social factors which can undermine the effectiveness of the operations. Therefore, patients must be willing to be supported and instructed properly in the use of these tools and must be willing to make changes in habits and lifestyle in order to be successful and avoid weight regain. Here at Advanced Surgeons, we offer a comprehensive program to help you with your weight loss goals. We have a full-time staff that includes a dietitian, exercise therapist, and mental health specialist to help guide you through your experience.
My name is Caitlin Cruz. I'm a registered dietitian and licensed in the state of Alabama. Think of me as your personal nutrition coach. Just like the rest of the team, our relationship begins early. I will see you before surgery, one-on-one and in pre-op class. I will see you about 2 weeks after surgery and then every 4 to 6 weeks after that for about 6 months. My role as your dietitian is to prepare you nutritionally before and after surgery. During our first visit, we will discuss the pre-op diet. This is the meal plan we place you on to prepare your body for surgery. I will also give you information on specific vitamins, protein supplements, and hydration. We talk about what to expect after surgery, the phases of advancement from thin liquids to regular foods, as well as protein and fluid requirements. You are considering bariatric surgery, and I am so excited for you. It's a big deal, and it can be a little scary. This is a lifestyle change. I want to be there with you, for you, every step of the way to encourage you, motivate you, and teach you. Together, we will focus on not only the amount of food you will be able to eat, but also the types of foods best suited for you. You will hear me speak words like high-quality foods, lean sources of protein, non-starchy green vegetables, fruit, and whole grains. You will be successful because not only will you have an amazing weight loss tool provided by the doctors, but with me you will also learn how to be healthy with your weight loss and most importantly to keep the weight off. We do have an online site store. Our clinic store has everything you need from meal replacements for the pre-op diet to bariatric vitamins, high protein powders, and high protein snacks. You may also visit our online store. Just visit advancedsurgeonspc.com, go to the bariatric site, and then click on the online store tab. We are a great team here at Advanced Surgeons. I work with some amazing people. We look forward to meeting you and working with you along this journey.
Congratulations! You've made the first step in achieving your weight loss goals. My name is Miranda Swanson, your fitness trainer. I began working with bariatric patients in 2005 as a circuit trainer and weight management facilitator. I earned a Bachelor of Science in Health and Nutrition and have over 10 years experience leading and instructing cheer and dance clinics, along with 3-year experience in pediatric nutrition. Dedicated workouts are great, but physical activity that you accumulate throughout the day helps you burn calories too. My job is to create fun, progressive physical activity programs for all fitness levels and accommodate for specific needs such as diabetes, arthritis, fibromyalgia, and osteoporosis. If you're moving, it counts. If you've moved more today than you did the previous day, then you're on the right track. During your initial visit, we'll discuss barriers to daily activity, your thoughts and feelings about exercise, and answer any pre- and post-op questions and limitations. Doing so helps me determine how I can assist you in establishing a lifetime habit of physical activity. All of our sessions are based on your current physical activity level. The benefits of exercise for weight loss surgery patients are numerous. Exercise enhances weight loss while mitigating the loss of muscle mass, promotes bone strength, tones muscles, enhances self-esteem, and reduces anxiety. It also boosts in the immune system, aids in skin elasticity, and assists in maintenance once your weight stabilizes. I'm eager to motivate and support you throughout your journey here at Advanced Surgical Weight Loss Center.